There we go. All right, so thank you for that wonderful introduction and for all the work that went into putting this together. It's the first time that I've been attended the conference, and I can say I've picked up a lot. I wasn't sure that I would, but it's been a nice balance for those, patients and providers and caretakers, and so just a wide range of topics. I found it very interesting. And so I've been making little notes like, oh, this ties in here. So we'll see how this goes. But thank you. My topic is looking at the balance between best case and worst case recovery scenarios is what I wanted to talk about. I'm looking at it mainly from the patient side. And so there is a doctor in front of my title there, but that's PhD. So given this audience, I just wanted to make sure that we have that straightened out. But from the patient side of things, I did want to talk to you about a few things. And in the future, if any of you would like to reach out to me, you can certainly reach me. My email is just firstname.lastname@und.edu. And as is traditional in my culture and kind of spiritual background, I'd like to start with just a few thank yous. Technically, I would like to start miigwech, just means like thank you. So miigwech, an acknowledgement of the space. And I know since we're doing this virtually, we're all in different spaces. We're not just in one space where we can thank the building and the air and the lights and the technology, right? And also to be thinking about the people that occupied this space before us, historically, 100 years ago, perhaps, right? All that energy, all that thought, we would not be where we are today, is it not for them, right? So I do want to acknowledge that, and maybe where you are, just to give a shout out for your beverages or the restroom breaks we've been having or things, being in a nice space really makes a big difference. I also would like to say thank you to the ancestors generally. We've heard several speakers over the last 2 days, I think, talk about how after stroke or things, you really tune in more and you're thankful more for all the little things, because you know how so quickly in a moment it could all be taken away. And we would not be here if it were not for our ancestors, our parents, our grandparents, and a long ways back, right? And so, yes, I want to send a thank you out to all of them, generally speaking, as well. Also, in the bigger picture, I have loved how so many people have been willing to talk a little bit about the importance of spirituality, of their belief system in playing a role for their resiliency in dealing with their stroke and traumatic brain injury. And I would like to do the same. So a thank you to the Creator and spirits that breathe life into us every day. Also, a big thank you to the organizers, to the sponsors who are willing to step up and pitch in while we're in this virtual environment, and to all the participants over the last 2 days. I think they've all done a remarkable job and have been very open and willing to share, and that makes a big difference. So thank you to every one of you. And to my family, some of whom might be tuning in and watching this. Hopefully I don't share anything too embarrassing. And always, I send my love to each of you. So I did want to start with something on kind of a personal note myself, and do a little bit of introduction of myself and my family, and then I'll explain why this is important in a little bit. So as was mentioned, actually, in my introduction there, that comes in handy. I was technically born in the United States, in northern Minnesota, but I was raised up in Canada. It's one of those things how many tribal communities cross the boundaries. Later governments like draw a line somehow through the water, this lake, this side is one country, that side is another country. Obviously in the beginning, we didn't think of that, right? So we're often going kind of from one side to another, pre-COVID, mind you. And so I did grow up. I want to see if my link will work here. Here's a picture of the big bridge, the suspension bridge that crosses from one side of Lake of the Woods. There's a narrows here. It's referred to as Sioux Narrows. And this beautiful area is the area that I grew up in. And I did spend a lot of time on the Indian Reserve, similar to a reservation, but refer to it as a reserve there. A very beautiful place. As you can see, lots of rivers and lakes and forests and streams and wildlife, and a lot of very beautiful things about that area. Oops, don't want that one. And see if I can jump back for a moment to here. I'll resume from there. So a very beautiful area, but there were also a lot of issues that I experienced growing up that we know sometimes those stresses early in life can lead to health complications later, which it did, right? So for any of you that are familiar with ACEs, the scale that looks at like adverse childhood experiences, I did experience a significant number of adverse childhood experiences growing up. I myself did not go to boarding school directly. I spent some time in the boarding school in the early grades, like 1 through 3. Mainly that was though for special school projects or to visit friends that were at the boarding school. My family actually fought. This is back in the day up in Canada, which is like yet another step backwards. I think sometimes we think in North Dakota we're behind the times. Oh, this is even more behind the times, right? And so no, I actually did experience some of the boarding school process and some of the difficulties and abuse, quite frankly, that went on there. But my family actually fought to have me go to the little 2-room painted white schoolhouse with all the majority kids. And that was a difficult situation, by the way, being thrust into that, but a far less abusive situation than what was found in the boarding school. A lot of things happened on the reservation. I am a big proponent of understanding and doing things about the missing and murdered Indigenous women because a lot of women, young and old, went missing on the reservation. Some of them relatives, some of them friends. So it was a difficult time and place to grow up. Beautiful, but difficult. When I was older, you would have to take the bus to the nearest town, which was probably like over 65 miles away from the reserve, to be able to go to high school. The little 2-room schoolhouse only went through 6th grade. After that, anything else, well, most people on the reservation just never went to anything else, right? And many people on the bus, if you were a minority and took that bus, you would get beaten up, you'd get thrown off, women were raped. My family would not let me take that bus. I'm going like, nope, you're not doing it. So I actually had to fight with the provincial government. They worked with me. I had to fight for my right for education, not wanting to be on that bus. And so I did correspondence courses from home for most of my high school experience, I guess you could say. But my family decided to pick up and go to Texas because my dad had this dream of shoeing horses. Don't ask me how or why. He loved Western movies, I guess. And he wanted to shoe horses. So he wanted to go to Texas and learn how to do this. And he did. And then we settled down in Wyoming, of all places. But there's lots of horses there. And they plopped me down in the middle of what would have been my junior year of high school. So I've been by myself learning through the mail for years and then just plopped down in the middle of that. It was culture shock. And fun at the same time. Made a lot of new friends and it was very different and I loved it a lot better than learning through the mail. And fortunately, that actually worked. I was able to do graduation. So there's like my senior graduation photo. You can see my little necklace with the, I believe that was 79, the year of my graduation. So there I am. Yay, so excited about that. And I did actually, finish my classes. I had to pass certain exams to show I had the equivalency. And so one of the few in my family to actually make it through high school. There I am in my gown at my high school graduation. Just super thrilled. It was a hard road hanging in there and making sure that would happen, but education has always been extremely important to me. Oops, no, there we go again, jumping out of order. Let me back it up. And so that worked pretty well. I wanted to leave my family as soon as I could, given our background. And so after high school, I did. I left the family. I had met a man I was in love with, and right away we started our little family. We got married and started our family, even though I was still technically in my teens at that time. But you know, that with many in my family, that wasn't unusual, to get married and start your family right away. And so I did. And I think I have a picture of family. There we go. Here's my little crew when they were younger, boy, girl, boy, and the man of my dreams right there in the center. I think we were celebrating a birthday at this time, and we had a habit, whenever it was one person's birthday, everybody would get a gift. So you can see my oldest enjoying his action figure, my daughter being an artist with her pastel colors there, and my youngest just enjoying puzzles. He liked to put together little puzzles. So there's a little bit of the family unit I was making. The problem was, though, that my husband became disabled very early on, and he was not able to support our little family. That fell to me. And with just a high school background and nothing else, that was not enough, really, to support a family. So I became bold, and I thought, what if? What if I went on for more? So I decided to go for my undergraduate. We're, remember, in Wyoming at the time, so I went to fairly nearby, Spearfish, South Dakota. Let's see if my link will work. There we go. There's a picture of Angel Falls in Spearfish, which is in the Black Hills region in South Dakota. Almost like back home, right? Does this sound familiar? So it was an excellent place and an excellent school. And I decided to focus on, I didn't know what to focus on. I did psychology, I did sociology, I did computer programming back in the day when they were just coming out with Pong. People are going like, oh, that'll go nowhere. This is the most boring thing ever. Yeah, computers are here to stay, right? We all know that now. And so I was in kind of in COBOL programming at the beginning of some of that. I think I have another photo here during the winter in the hills near the Spearfish area. Again, much closer to home, right? Not so homesick. And I did finish in record time. I earned my Bachelor of Science degree. And there I am in my graduation cap for that. Yeah, tried a perm. No, won't do that again, but there we go. So I'm happy that I did it. Raising my family, working in the field of corrections at the time, doing probation and things in criminal justice, trying to support my family. And one of the things, since I was against, I don't know, racial biases and that kind of thing, I noticed doing probation, they had me near Rapid City working with people on the reservation. There were some biases in how probation was being run, how the people were being treated in the court system. I had some very easy and grounded recommendations how to improve the system. No one would listen to me. So I asked my favorite instructor and advisor just before I graduated, it's like, what do I need to do? Because I tried talking, I tried meetings, I put it in writing, I did memos, like no one's listening to me. What do I need to do? And my advisor spoke in riddles. She goes to me, what is after your name? Well, I don't know. What is after my name? This is confusing to me, right? I'm not sure about that. And so she mentioned, well, you're about to graduate, right? So after your name is BS. Is anyone swayed by a bunch of BS? Like, oh, I get it. No, I probably need to do something more than a BS. Is that what you're telling me? She said, yes, you need the whole alphabet soup after your name. If you can do that and do research and get that printed and in writing, then they start to listen. It's like, okay, I think I can do that. I wasn't sure I could, but she believed I could. So I went ahead and decided I would go a little bit further. Let's at least try my master's, I guess. So I decided if you're going to study crime, justice, racial inequities, all the problems with our system, I don't know, where would you go? Texas might be a good place to go, right? So I did. I went to a school that specializes in criminal justice by the name of Sam Houston State, and I think I have a photo. There's one of their old buildings on campus, a very historic campus, a very big criminal justice program. They have like their own buildings, and it was an amazing place to learn about criminal justice. And it's in Huntsville, Texas. Again, a lot of culture shock, but what a wonderful place to learn about some of the early history down south and meet some wonderful people. And I got involved and did more corrections in the prison, wrote books, did a lot of things while earning my master's. And, you know, I just kept going. Why not? Why not my PhD as well, right? So doing research and publishing and teaching and raising my little family and finishing up my PhD. So that's what I wanted to do. And when I was done, I had to face a decision to teach or to do research primarily. Certainly I do both, but what do you want to focus on? And I definitely enjoy teaching and interaction with students. So I was looking for a job where I could do both, but with an emphasis on teaching. And I wound up at the University of North Dakota in Grand Forks. And yes, I wanted to do that. I was at a conference when I met some colleagues from UND. They liked me and my topic so much, and I hit it off with them. They invited me to come interview on their campus, and it went really well. And I love the campus, I love the students and the people there. And so it's close to back home again, right? And there's outside the O'Kelly building with the beautiful flowered and manicured gardens and that kind of thing, just a great place to work if you ask me. And I have been here for 30 years, so I guess I've been pretty happy with it, right? And so not just the place, but the people, especially the students. To me, there's a picture of one of my big mass intro classes, and this is only about a third of the classroom, as you can see. And so I loved it, right? Things were going really great in this new position that I had. And then something's going to happen, right? I happen to be at the middle of a Girl Scout cookie training. I was doing Girl Scouts. I'd done Boy Scouts for my sons, both of them. And I was doing Girl Scouts for my daughter. And I happened to be the community cookie chair. And I was at a Girl Scout cookie training when I had the absolutely worst headache. I very rarely would even get a headache, but this was just such pain that I almost fell to the floor when it happened. I went to the restroom in the middle of the training and I laid on the floor and someone could hear me crying. And they went and summoned help and they're going like, "Are you okay?" It's like, "You need to call my family because they need to take me to the emergency room. This isn't right." And so I went to the emergency room. My family came in. They took me there. They at first said, "There's nothing wrong with you." It's like, "No, trust me, there is something wrong." I argued with one of the doctors that they called in. I'm going up. I know that this isn't just a headache. They're going like, "Oh, maybe it's your time of the month." It's like, okay, I've had plenty of those. This isn't it, right? That's not it. I was young and they were very dismissive, thinking what was going on. I'm so proud to hear with the other presentations that a lot has changed and improved since this happened to me. But at the time, they just, they sent me home. "There's nothing wrong with you." I did insist, like do something. They did a spinal tap, and the doctor was very rude. I could barely see. The lights were bugging me. The sound was bugging me. Like everything was horrible. And he held like a little vial in front of my face. Says, "Can you see this?" And I'm like, "Kind of, yeah." "Do you see blood in it?" And I'm going like, "I don't think so." It goes, "Yeah, because there isn't, because there's nothing wrong with you." Because I said, "Maybe I'm having a stroke or something." "Nope, look at this. There's nothing wrong with you. Go home." So I was in and out, seeing a neurologist, went back to the emergency room. I was in such pain. They thought I was seeking drugs. I was told, "Go to Indian Health Services if you want to get your drugs. We're not going to give it to you here." And it was actually in the parking lot of the neurologist's office. My husband was in paying the bill. I couldn't stand, like I was in too much pain. I was out in the van waiting for him to come out, and I was going to ask him to take me up to the emergency room again. It was just so bad. When it happened, it felt like a waterfall inside my head. And from that moment forward, I've never felt my left side. It's been gone. I couldn't sit up. I couldn't speak. I knew something was seriously happening right that moment. So I managed with my right hand to bang on the window and do some kind of guttural growling, like it wasn't really words, but I was kind of trying to yell and bang on the window. And it caught the attention of people in the parking lot who went in and got my husband. And right away, he took me up to the emergency room. But yeah, sending me to just go get to Indian Health Services. I'll give you drugs. That's not what I was trying to do, right? It was much more serious than that. Oops, sorry. I'm gonna jump ahead now. Go right back here. Try this again. This one. There we go. So that's kind of some of my background. Now let's get to the main point of my presentation, right? And I do want to thank you for your willingness to listen to that part. I like this quote from a Greek philosopher, Plutarch, know how to listen and you will profit even from those who talk badly. So hopefully my presentation and the point I'm going to be trying to make comes through. Even if I talk badly, hopefully you get something out of it. And certainly I know I have picked up quite a bit from all the people that have been talking throughout this conference. So just listen and hopefully you will continue to get something out of the presentation, right? So for the learning objectives from mine, I tried to focus on three main things. First, I'd like you to kind of just sit in the moment and develop an appreciation for the possible emotional impact of recovery-related information when you're relaying that to the patient and their caregivers. And I'll have to admit, I was a little bit worried about the audience I would be presenting this to. But certainly, I think many of the presenters have actually been kind of pushing this. You know, think about the patient, listen to the patient, consider the patient. I've been really impressed with everybody kind of pushing this message, and I would like to push it as well. Secondly, I would like you to think about, as best as you're able, how when you're working with a client or a patient and their caregivers, how to differentiate and make that decision, which can be so difficult, of course, between being too optimistic, you know, everything's going to be fine, we ran scans, you're fine, you know, everything's just really great, when it's not. But you don't want to go to the other extreme and be too pessimistic. Throughout my recovery journey, I cannot tell you the number of times I've been told straight to my face. Often they'll bring in a little counselor and they'll have other people with you in case you're going to freak out, and they tell you how soon you're going to die. Okay, I think that's overly pessimistic, right? Like, there are risks. I understand that. Things may be difficult. I understand that. Death sentences, I don't know that we need to go there. Exactly. Is there maybe some happy medium or some way to kind of navigate that? Because if you even know you need to bring in a counselor as you're about to deliver this bad news, you know, obviously this is going to be emotionally hard on the patient and their caregivers. Perhaps we could have a glimmer of hope, some choice, some opportunity for improvement. You know, let's not just be all gloom and doom. That's hard. It's hard to listen to and hard to take. And number three, being able to maybe integrate some of the information from my presentation and all the others you've heard over these last 2 days, to kind of think about a more tactful way or a better way to approach conversations with patients and their caregivers during patient meetings that you might have in the future. So let me share with you a little bit about my TBI story, right? So at that moment in the van, the waterfall feeling, right? Apparently, for over 3.5 days that I'd been trying to get help and no one would listen, I had had a blockage. And as we learned, right, um, from many of our presenters here, but like Marie in particular, Teresa as well, we've heard many things where they went over like the parts of the brain and so on. So yes, apparently mine was both ischemic and then hemorrhagic, right? So it was first a blockage that then swelled until it finally ruptured and then bled out. And then when blood touches brain tissue, time is of the essence. At least once I had the rupture, they waited far too long for the blockage. But once I had the rupture, immediately I went to the emergency room. And like some of our other survivors, I'm very thankful for the care that I was given there. It obviously meant the difference between life and death, right? The thing of it was, is that there was a surgery that they could do to try to save my life. I was not aware of this. I had gone basically into a coma at this point once they got me up to the emergency room. But the doctor met with my family and he told them to probably not do the surgery. There's no point, just let her pass. There's less than a 5% chance that she would survive the surgery. You're gonna have to go in deep. There's been so much damage. It took so long for this rupture to occur. We're probably not gonna be able to save her, and what would be left of her to save. And my husband, he said, you don't know my wife. She's a fighter. She's been through a lot in her life. She is determined. She does not give up on anything. You don't give her a chance. You need to do that surgery. We need to respect her enough to give her a chance. And I'm thankful that my husband was my advocate at that moment and convinced them to give it a try. It was, in fact, a difficult surgery. I mainly now have titanium plates for brain. The pressure had gotten so severe that it fractured my skull. And they had planned, like, we'll do a little hole, and yeah, that's not how this all turned out to be. There was so much blood and so much damage, and the midline shift and a torn optic nerve, and they had to completely shave me bald and do a major surgery. And now I have numerous titanium plates and screws for a skull. And I was in a coma for a while, both prior to the surgery as well as afterwards. Some of it they induced, and some of it I was just in because of the shock and the trauma. After I came out of the coma, that's a whole nother story, but anyway, after I came out of the coma, they decided to move me into inpatient rehabilitation. They asked if I wanted to do that, and I didn't totally understand everything that was going on, but I told them I did want to try that. And I worked on trying to, because in the beginning, I couldn't even sit up. I couldn't do transfers. I couldn't eat without the giant bib. We heard about the importance, right, of remembering not to breathe while swallowing. I had forgotten that. I was that person. Is there still food in your cheek? All right. Where is your tongue as you chew? I mean, from trying to formulate words, remember things, I certainly wasn't walking and talking well. It was pretty extensive. They did what they could for 6 weeks, which is about what my insurance covered. And then the choice was, are we going to send you home or are we going to send you to a home, right? Because I had difficulty, I was in a chair, I had difficulty transferring. I couldn't walk at that time. I had still a lot of issues even after the 6 weeks of very intensive therapy. And while I was there, by the way, I would like go into the bathroom to cry because I noticed if I was out just on my bed and cried, my medications would be different the next day. So it's like, I'll hide this because I hate when they keep switching my medicines and not telling me what's going on. So it was difficult and it was a challenge. They suggested that I be moved into a home because I was likely not going to live very long. It's one of my death sentences, right? My family goes like, no, we're taking her home with us. We're just going to do it. We're going to try it. And they worked therapeutically with me. I did outpatient therapy. I did not give up. It was quite a journey. I wanted to be all better, but at some point, as a stroke survivor or traumatic brain injury survivor, you realize I'm never going to be the same. This is a new me. So let's try to be the best new me that I can be. And you just learn to accept that, right? And so I want to be the best new me that I can be. Here's another quote. Courage does not always roar. Sometimes it's just that quiet voice at the end of the day saying, I will try again tomorrow. And so you get up and you try again tomorrow. And slowly over time, you improve. And there's the author of that quote. And so I did improve. You know, for that first objective, to just realize the impact of what you have and what you say to people, because as we've heard, several of our presenters would agree with me, patients are different. You can't just say they're a stroke person, they won't recover, they're going to die, they're going to have TBIs, I'm pretty sure, sorry, they're going to have those TIAs, they're going to probably not make it. I don't know, maybe look at their background, look at who they are, look at a variety of things. They had told me after a stroke like that, I would never work. I'm going to be a burden to my family. I'm probably going to die within 3 months. I would never walk or drive again, right? We heard about driving, like that's never going to happen. You're going to be so depressed that if health doesn't kill you, you'll probably kill yourself. Like who says these things? But that's what they were telling me, right? Like your outlook is just horrible. You will be dead within the year. You will never be as good as you were. And any improvement that you're going to see it in the first 3 months. After that, nothing will improve. That's so not true. It is an invisible injury. I will not be as good as I was, but in some ways, I am better now than I was before, right? And I can continue improving beyond 3 months, right? You can keep working on your gait. You can work on your speech. You can work on your memory. You can work on these things. There's a link to an article about how many in the medical field are so nihilistic, right? Like you're going to die, these horrible things will happen. It's like, why do we tell patients that? That is not encouraging in any way. For my second goal, I know you don't want to be too optimistic and unrealistic. It is going to be a challenge. Things won't be quite the same that they were. There are going to be health problems. We've heard some of the research about how even in the future we should look out for things like dementias or other problems with our vision getting worse. I mean, we understand this will happen. Mayo and the American Stroke Association say there are many things, though, that you should consider when giving advice to patients, that we're not all the same and how we recover will be different. Where in the brain the stroke occurred, we've learned that during these proceedings, right? How much of the brain is affected? What is that survivor's motivation? What is their level of motivation is really key. And with me, none of the doctors took that into consideration, not the ones that were working with me. What is the support that you may or may not have from caregivers and friends and family around you? And the quantity and quality of rehabilitation that you could avail yourself of. To me, that has made a big difference. Having that available and doing it, I think, is important, and the survivor's health before the stroke. I would add, it's not on their worksheet or in their literature that I could find, but also the quality of the medical care that they received, immediately, like during the stroke, the quality of that surgery, the survivor's resilience and their determination to continue to improve. Spiritual factors. We've heard how important that is to many survivors, and people don't talk about that. They don't ask you about that. And I think that's wrong. I think we should start paying more attention to that. And the extended support network, maybe colleagues at work, family and friends, support groups, right? And availing yourself of those things. I think all of these are going to help a person's recovery, and maybe get to know your patient and check out these things as well in trying to determine what they might be able to achieve, how they can recover in the future. And for that third one, being able to kind of integrate some of this in your meetings with patients in the future. It is true that gains can happen quickly over time. Those first 3 months, those first few weeks are really essential. Get on it and habit and repetition and all the things that we've heard all our excellent presenters talk about. I agree. But I think it goes beyond that. I mean, some survivors, the literature tells us, recent literature, that they can continue to recover well into the first and second year. That again is some fact sheets from the American Stroke Association and Mayo. I would change that. Why first and second year? How about first and second decade? It has been 20 years now since my stroke. I still routinely will go do some rehab, go work on my gait, go adjust my bracing and my assistive devices so I can improve and challenge myself and improve even better. Why quit after 2 years? Don't quit after 2 years. There is more we can do. Why do doctors just look at you and say, oh, you seem to be doing okay? Why not look at me and say, you seem to be doing okay. What would you like to work on? What more could we improve? How could we help? Right? I think we need to be, I think it was one of our first doctor presenters who said, you know, let's try to be more encouraging. What more would you like to accomplish? And let's keep working on that with the patients and with our clients. And work with them not just to maintain. Why are we doing that? Let's work with them to improve. Many years after, we can still work on improvement, right? And maybe let them be aware of things to look out for that may start failing. But here's what you could come in to do to help, you know, diminish that or put that off as long as possible. We've heard some really helpful and encouraging words from our presenters during this conference. We need more professionals out there in the field, like the professionals we've encountered during these meetings. And I think we also need to be important to make sure that when we work with the patient and the client, that we're not just telling them, do you understand? You know, and take the time for that. Here's the team, do you understand? We need to be asking that patient, what do you want? Out of all these options, what would help you? What would you like to see? They might have some opinions of their own. Imagine that, right? And so I think not just to make sure they understand, but to take the time to really listen to them and see what it is that they would like to do. And, you know, maybe it's a stretch and be honest with them, like, well, right now, I don't think that's realistic, but here's one step you could take towards that. You could work on that and then come back. If you can achieve that, we'll go for the next step, right? I think we need to be more encouraging and more supportive of the people that we work with because decades later, you can still be improving. So here are some ways, not just to save my life, but the people that helped me and have been helping me. They impact not only me, but my family. Here's some of my graduating students and all the good they're going to do as they go out into the world. Here are some colleagues that I've worked with. That was just a bit after my stroke. You can see my hair is like kind of shoulder length versus as long as it gets to be when you let it grow for a while. And so think of all those wonderful professional women and all that they do and the people they interact with. These are all things I've accomplished post-stroke. I got involved with the National Women's Studies Association, helping them with accessibility issues and helping handicapped people go to the conference, enjoy the conference, get around at the conference, be on task groups and workforces so that when they go back to their employment sites, people that are differently abled, since a lot of people said, I hate that word disabled, try differently abled. We need some accommodations, but it doesn't mean that we're not capable, right? And being a regional chair to help people in many states, as well as nationally. And there I am receiving my 25-year certificate for working at UND for 25 years and continuing, right? So it does not have to be a death sentence. Certainly, life is different. Life is challenging. I have good days and I have some not so good days. But I think that if we can be more encouraging, we would perhaps see even better gains in the people that we work with. And so there are some resources that you could take a look at for those that are interested. And I'd like to end now and see if there are any questions.
Thank you so much, Wendelin. Good to hear your story. Anybody have any questions for her? Type in the chat or in the Q&A box. What would you say motivated you the most during your recovery?
I would say probably my family. I mean, they came and visited me, even though I'm in that big bib and choking, and it's so embarrassing. But like they would come and occasionally eat with me. We had like a Halloween event, and they came and watched me do my little thing. I won an award for looking like G.I. Jane because my head was all shaved and stuff, right? But they were just always there and so supportive and encouraging. That really, I found that very motivational.
Let's see, where did that one go on me? They move around. Someone else asked about your optic surgery. If you could talk a little bit about like what kind of surgery it was.
Yeah, so with that, they didn't so much do surgery on the optic nerve. It was more about apparently like the placement of like surgical gel foam and things to readjust the alignment of the brain to take the pressure off the optic nerve. And then I had to work with opticians that we heard about, the neurospecialists with like glasses and special lenses and filters and training of my eyes to be able to refocus. And again, also training of the brain to be able to reinterpret what it is that your eyes see. So a lot of work there, not surgical, but most of it was actually lenses and filters and practice and repetition, practice and repetition.
Okay. I got another comment. Thank you for a great presentation. So glad your husband was your advocate. And another one that says, thank you, inspiring message. Love the next decades versus years. I'm going to use that. And we got one that says, I'm so worn out, can't even ask questions, but such a great ending speaker. Anyone else? Oh, thank you for so much for your wonderful presentation, and congrats on your amazing recovery. Great jobs. Yeah, I think we're good on questions.
Great job.
Yes, thank you so much.
So yes, thank you so much, Wendelin. And we were happy to be partnering with Wendelin because we're going to start working more and more within the criminal justice system. And so I think it's a great partnership with Wendelin because she has all that background and knowledge, and to be able to bring her background and knowledge in criminal justice and then additionally knowledge in brain injury as part of it. So I think that's fabulous. So we look forward to continued ongoing partnerships with Wendelin.
Yes, I'm very excited too.
So yeah, I think it'll be great. So yes. Well, thank you, everybody. We are at our end of the conference. So this has been different this year, doing it virtually, but we appreciate everybody that has stuck with us. We do so now just have some wrap-up pieces. One, we will be putting the evaluation link out for you guys. You will be getting an email and then also in the chat.
And it is, it is also on the it's on the link on your materials page where you've got your handouts and your agenda and all of that. It is up there now for you as well too. So please
feel free to go ahead and do that. If you want CEUs, the way to get CEUs is you have to complete the evaluation, and then at the end of the evaluation, you will get the link for the CEUs. That is our way of forcing you to do the evaluation.
Yes.
So go ahead and complete that. The link is out there, lots of things. And as always, if you lose that, forget, whatever, you can feel free to reach out to us. And so we appreciate that. And then the materials, any handouts or anything that you didn't get a chance, those are on the website for you.
Recordings will be up there eventually too. We will give me some time to edit those and cut those down a little, but those will be on that password protected spot for you as well. We'll leave that up for a couple months, or we'll leave it for a while. So we'll give you a heads up before we maybe close that down. But yeah, recordings will all be in there too.
So yes, and then our final piece is we're going to do some awards recognition, and then we have some drawings. So starting with awards and recognition, this year at the Brain Injury Network, we wanted to start taking time during the conference to be doing some awards and an opportunity to recognize some of the awesome people that